So we're going to do it as a little bit of a tutorial. I'm going to talk you through what we're doing, but whilst I'm doing it, I'm going to be telling you what maybe with some hints and tips as we go along. Okay, so the first thing that you're going to have with ANTT is you've got 17 minutes to complete this station. This is a station where you don't need to be interacting with the patient at all, so you will be able to just identify with the examiner that all your pre-procedure checks have taken place. Okay, so your first port of call will be in the treatment room, okay, and this will be when you're going to be starting to prepare yourself ready for your procedure. Okay, so upon entering the room, you are going to be doing what you would always do within every scene, is that you're checking for scene safety. So you're establishing that the scene is safe for you to approach. And again, as with all things, you will always be doing your 7 steps of hand hygiene, and you will be talking that through with the examiner whilst you're doing it. Okay, so we suggest that you just do that for the first time that you do it, but other than that, you won't need to do it afterwards, okay, at all. All right, you just need to be doing it as you're doing it. Okay, so you are confirming with the examiner that the pre-procedure checks have taken place, and you will then be able to start getting your trolley prepared ready for the procedure. Okay, so the first thing that you need to do is you need to put yourself on an apron. And a pair of non-sterile gloves. Okay, and at this point you need to confirm with the examiner that the trolley that you're going to be cleaning has been cleaned with soap and water within the last 24 hours. The examiner will confirm that with you, and that enables you then to just clean it with a Clinell wipe. So the first thing that you're going to do is you're going to get your Clinell wipe. You're going to check it over. You're going to ensure that the Clinell wipes are within the expiry date. They expire in 2024, and the packaging is intact. You'll be looking at your Clinell wipe, and you'll be getting your trolley ready. Okay, so when it comes to cleaning your trolley, you're going to start from the top to the bottom, from the furthest point to the nearest point, and you'll be going to be doing it in a nice methodical manner, ensuring that every area of the trolley has been cleaned. You'll then be disposing of this in the clinical waste bin, and you'll also be removing your apron and your gloves. Okay. You'll be wanting to wait for that trolley to dry. Okay, so whilst you're doing that, you'll then be giving your hands another clean using the 7 steps of hand hygiene. Okay, so the next thing that you're going to be doing is you're going to be getting your articles ready to put onto the trolley. So at this point, you've got clean hands, you don't need to have an apron on, you're absolutely fine to be getting your articles ready to go onto the trolley. So for aseptic non-touch technique, you're going to be redressing a simple wound. So you will need to make sure that you have got a wound pack. Now for every wound pack, again, you go through exactly the same thing with every article. You check that they are intact, verbalising this to the examiner, that they are in date 02/2022, and then you'll place that on the bottom of your trolley. The next thing that you'll need for your aseptic non-touch technique is you'll need alcohol wipes to clean your sterile water. So that is chlorhexidine alcohol wipes, 2 of those, expires 11/2020, packaging is intact. Also got water for cleaning the wound. I'm going to take 2 of those with me, 25 mils of normal cell water, and they expire 04/2020. Checking that the packaging is intact on both of them, and that there's no evidence of precipitate in there. That can also go on the bottom of my trolley. I'm going to need my wound dressing. So I've got a Meepor dressing, and that is intact, and it expires in 2021. I'm also going to bring along with me, just in case I need them, a spare set of sterile gloves. So within my wound care pack I have got sterile gloves, I've got a galley pot, and I've also got gauze, but just in case there's something wrong with my sterile gloves or I rip them, it's useful for me to be taking a spare set with me, because I'm going to be doing this as if I'm a lone worker. So I've confirmed that this is a size small, which is fine for me. The packaging is intact and it expires in 2019. That's absolutely fine. I also want to take with me a pair of non-sterile gloves as well in case I might need them. And again, I'm checking that the date is intact for them, 2021. And I'm going to do a visual check over. Is there anything else that I think that I need? No, I think I'm quite happy with what I've got on my trolley there. So the next thing that I'm going to be doing is, again, decontaminating my hands using the 7 steps of hand hygiene. And I'm now going to be preparing to go to my patient's bedside. So to do this, I'm going to apply an apron. Before I enter my patient's area. I'm then going to be walking over to my patient area, only touching the legs of the trolley as I go over. As I'm walking over to my patient area, I'm ensuring that I'm maintaining the patient's privacy and dignity, trying not to disturb the curtains too much as I go through. As part of my pre-procedure checks, I'd already ensured that the windows and curtains have been closed and housekeeping activities have been ceased in the previous 30 minutes, and that have been confirmed by the examiner as part of my pre-procedure checks, so I don't need to repeat that again. Okay, so again, as I'm entering a new area, I'm entering the patient's room. The first thing that I'm going to be doing before, as I enter the patient's room, is I'm going to be doing my 7 steps of hand hygiene. And I'm also going to be checking for scene safety whilst I am here. So I can see that the patient has got a call bell by them, so I'm just going to move that to the side of that. Obviously, I would be explaining to the patient what I was going to be doing and ensuring that consent was still in place for this to take place, which it will be, as again part of my pre-procedure checks. Okay, so the next thing that I'm going to be doing is I'm going to be applying my gloves, because I would like to expose the patient. So I'm being mindful when I expose the patient and I go to the patient's bedside that the bed is at a safe height for me to work. Again, before you start your scenario, you'll have an opportunity to make sure that the bed is at the correct height for you. So that should be absolutely fine. And then you can just roll carefully back the area that I'm wishing to expose, not exposing too much of the patient where possible, to ensure that I'm maintaining privacy and dignity of the patient. So I am exposing the patient's dressing. I can see that the dressing is intact and it is clean, but I would still like to change it as per care plan. I've also checked that the bedding is visibly clean and that there's no soilage to this, and I will be verbalising to the examiner that if there was any staining to the sheets, blood or fecal or anything like that, that I would be ensuring that the sheets would be changed. Okay, so now I'm just making sure that the patient is comfortable, and I will start to gently remove the edge of the adhesive from the dressing of the patient. So at this point, I'm ensuring whilst I'm doing this, I'm not exposing the wound, I'm just literally very carefully removing the adhesive edge. Now lifted. Okay, so I'm now happy that I have got that prepared. So I'm now going to be removing these gloves, and they're going to be disposed into a clinical waste bin, which is just on the other side of the room. And as I've removed my gloves, I'm going to be doing my 7 steps of hand hygiene once again. So the next thing that I want to do now is I want to get my articles ready on the top of my trolley. Okay, so I have got clean hands, and I'm now going to be starting to arrange my articles on the top. So the first thing that I now need to do is to get my wound care pack. Okay, so again, being careful when I'm moving the trolley, I'm only going to be touching the legs of the trolley. And I'm going to be opening up my wound care pack. I don't need to go through any of the expiry dates or anything on there because I've already established that with the examiner previously. So I can literally just open up my packaging. Okay, as I take it out, I'm ensuring that it's the correct way up so that the flap is at the top, and I'm carefully popping that on the top of my trolley. Okay. So now when it comes to me opening up my dressing pack, I need to be careful what part of the dressing pack I am touching. Obviously the inside of the dressing pack is sterile, so I don't want to be touching anything on the inside of that dressing pack. So I can touch the dark green area on the dressing pack and open it up. Okay, as you open it up, you see there's a nice little lip quite handily there, just for you to run your hands underneath, touching only the dark green bit underneath, not touching the lighter green that's sitting on the top. I will then open it up. Okay. So I've now got this opened. Okay. So the next thing for me to do is to make sure that I've got everything within my sterile field ready for me to manoeuvre when I come to use my orange bag. So I'm going to want my dressing in my sterile field. So I'm going to open up my dressing carefully without touching it, so only touching the outside of the packet. I'm going to carefully place that into my sterile area. Okay. If I felt that I knew that my sterile gloves that are going to be a medium within this packet was going to be too small for me, I'd also be opening up my spare gloves if I wanted a larger pair of gloves at this point. I'm quite happy that the medium gloves are going to be fine for me, so I'm not going to put too much in my sterile field that I've got to try and work myself around. Okay, so the next thing that I'm going to do is I'm going to get my orange bag, and I'm going to use my orange bag as a sterile glove to help me place things in my sterile field. So again, I'm being very careful what I touch on my orange bag to ensure that I do not touch the outside of the packet. So I'm touching the very top of the lip, which is where, which is the top of the bag, and then I'm going to carefully place my hand inside the glove, noting that I haven't touched the outside of the bag at all. So this bag is now completely sterile and my hand is concealed in it, and this will enable me to rearrange my sterile field exactly how I want it, so it's easier for me to work with. Okay, so what I'm going to be doing is I'm going to be moving my dressing just out the way, and I'm going to be opening up my sterile glove packet so that it's as easy as it can be for me when it comes to me putting my sterile gloves on. Okay, so I'm able to quite confidently touch everything within this sterile field because I'm touching it with my sterile bag. Okay, I'm just being mindful that my dressing, I don't want anywhere near my water pot, just in case any water spills onto it. I don't want to contaminate that. So now I'm happy that my sterile field is laid out as it is. I'm just doing a visual check to make sure that everything I want in my sterile field is there, and I'm happy that it is. So the next thing that I'm going to do, with my hand still enclosed into the bag, I'm going to be removing the dressing from the patient, inverting the bag, and then attaching the bag to the bottom of my trolley. This is now going to act as my clinical waste bag for me to complete the rest of my procedure in with. Can be a bit tricky to get it to stick, but I think I've made it. Move the rest of it. Okay. Next thing I'm going to do, I'm just going to desanitize my hands once again. Okay. So I now now need to be thinking about what I need to do before I put my sterile gloves on. And what I need to be doing is I need to be getting my water prepared now, ready to clean my wound. Okay, so I'm going to be getting one of my sterile waters and one of my alcohol wipes. And I'm going to be locating what is the top of the packaging, which is just there with the black serrated line across the top. And I'm going to open up my alcohol wipe. Now I need to sterilise the top of this water for 30 seconds. So that's continually rubbing it for 30 seconds. Okay, you will have a timer in the room with you, so you will be aware of what 30 seconds is. You do have to do this to exact time. So if you find that it helps you to count it out, please do, or if not, just keep your eye on the time. As long as you're making sure that you're verbalising to the examiner that 30 seconds has taken place. 18, 19, 20, I now need to allow my sterile water to dry for 30 seconds. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now satisfied that I've waited 30 seconds for this to dry, I can now open the water and get it put into my galley pot. So again, I'm being really careful how I open it because I have decontaminated the top. I don't want to recontaminate it with me. So I'm being careful that I only touch the very top and I do not touch the water too much and try not to spill it everywhere. So gently pouring it into the box there. Okay, and then that can be discarded. Okay, so I'm happy now that I've done everything that I need to do whilst I've not got my sterile gloves, that I can now prepare myself to put my sterile gloves in place. So again, I'm going to decontaminate my hands. So I now come to the bit where I need to put my sterile gloves on, and again I need to be really careful what I'm touching within my sterile field. Okay, so I know that I can touch the inside of my glove because that's going to be touching my skin, so I'm being very careful what I touch when I pick it up. And I'm going to be placing my hand carefully in the glove, ensuring that the outside of the glove doesn't touch my skin in any way, shape or form when I put it on. Okay. I now have one sterile hand and one unsterile hand, but my area here is sterile, so I can now confidently touch the inside of the sterile field with my sterile hand, ensuring that I don't touch anything that isn't sterile. And I can now get my second glove ready. Okay, so again, I know that I can touch with my non-sterile hand the inside of the packaging, but again, being careful that I don't contaminate this hand, so I do need to be mindful when I come to popping this one on. So again, I'm being careful not to touch my clean hand onto my skin. So again, I'm not touching it at all, and I've now got sterile. I'm now sterile with my sterile gloves on. Okay, so now I can very confidently touch everything within my sterile field. So the next thing I now need to think about doing is draping my patient. Okay, so you are provided with 2 drapes within the wound care pack. And again, these are sterile, so you can quite confidently touch these, but I'm being careful what I touch when I come to the patient because I do not want to decontaminate my hands by touching the patient. So when you come to draping the patient, make sure you give yourself enough room to work with, so that you're not draping the actual wound site. Okay, so my patient is now draped and I can now begin cleaning the wound. Okay, So at this point I'm going to be identifying to the examiner which I'm going to be keeping as my clean hand and which one I'm going to be using as my dirty hand. So I'm going to keep my left hand, which is nearest my dressing sterile area, as my clean hand, and my right hand nearest the patient I'm going to keep as my dirty hand. But at the moment it doesn't matter which one I choose as long as I make sure the examiner knows that I've identified two different ones. So using the swab with my clean hand, I'm going to be popping that into the water. I'm going to be getting rid of any excess, and I'm going to be carefully dropping that into my what will be my dirty hand. Okay. I then come over to the patient's wound, and I will do a very simple wound description to the examiner. So I can see that the wound is clean. It has got 3 sutures in place. There's no signs of inflammation or wound ooze. So I'm now going to be cleaning the wound, and I'm going to be doing the cleanest area to the dirtiest area, or the furthest to the nearest point. Okay, I'm going to do that in one single stroke. Okay. I then very carefully pop that into my clinical waste bin, being careful that I don't touch anything. Now I've made the assessment that I'm happy that's suitable cleaning, because I don't want to impede any wound healing by over cleaning the wound. So I'm going to now allow that to dry. So again, now I'm being very careful when I come back to my sterile field that this hand now is contaminated, so I'm not to be going into my sterile field with this hand. But with my clean hand, I'm going to be going into my sterile field to get my wound dressing prepared. Okay, so I'm going to turn that one over, and I'm going to make this nice and easy for myself. I'm going to remove one side of the backing already, so I've got it ready for when I come over to the patient. Okay, then being very careful what I'm touching, because I want to maintain the sterility of the wound. I'm going to be popping that dressing on. Okay. And then touching as little as I can, I'm going to then apply the dressing. So now that the dressing is in place, with my non-sterile hand I can touch the top of that dressing because it's not going to be coming into contact with the wound. Okay, so I can now carefully pop that on to ensure that the wound is covered. Okay. I'm now satisfied that the wound is covered, so I don't need to worry about sterility anymore. I can now happily remove my plates and pop them in my clinical waste bin. And ensuring the privacy and dignity of my patient, I will be then recovering them up, ensuring that they are comfortable. If I change the position of the bed, I would then be removing that back down to an appropriate height. And then I'm going to be getting rid of my articles on the hospital trolley and popping that directly into the clinical waste bin. I'm also going to be removing my gloves and my apron. Again, making sure that that's disposed of in the clinical waste bin. I'll be ensuring that the patient is comfortable, that they have got their cool bed in reach. Okay, and ensuring that their privacy and dignity is maintained. I'll now at this point be verbalising to the examiner that I will be going to write my notes up, where I'll be documenting that I have completed the wound dressing as per the care plan using aseptic non-touch technique. I'll also be taking my trolley back to my treatment room, where I'll be disposing of all my articles and waste in the clinical waste bin, and I'll be ensuring that I decontaminate the trolley using Clinell wipes. And that's the end.